Chief Nursing and Midwifery Officer. I'm here to provide the COVID-19 update for today, September the 29th. Total cases now in Australia, 27,063. That's an increase of just 20 in the last 24 hours. 10 of those were in Victoria, 3 of them will be known to be locally acquired and part of a currently known outbreak, and 7 are under investigation. New South Wales has seen 2 cases, both of them from overseas returned travellers, and Western Australia, 8 cases, but again all acquired from overseas and in quarantine. Sadly, now in Australia we have had 882 deaths associated with coronavirus, 7 new deaths reported in the last 24 hours. And again, sadly, I do offer my condolences to all of those who've lost loved ones, friends and family during this pandemic. There are now approximately only 420 active cases across Australia, which is an increasingly very encouraging number. 60 people remain in hospital and 8 of those being cared for in intensive care. We've now seen more than 7.5 million tests conducted for COVID-19 in Australia, 26,000 or just over 26,000 in the last 24 hours. Other aspects today. Today is Police Remembrance Day. And I acknowledge all of the police officers across the country, many of those who have made a sacrifice of their lives, and we recognise the effort that they've made. I also recognise the effort that all police officers make that keep us safe now and also have made an enormous effort during this COVID-19 pandemic. As expected today, the worldwide number of deaths exceeded 1 million. That's 1 million people out there, loved ones, family, friends, not just a number. And it represents, of course, as I said, 882 Australians who also have lost their lives in this pandemic. The milestone is very sombre, and it is a devastating human toll for the world. And sadly, it was not by any means the last of the milestones we'll see in deaths in coming days, months, and potentially years. So that's why it's important that we all need to stay vigilant. We know in Australia now we're seeing very low numbers of community transmission. But that's as a consequence of all of the amazing effort that's been done by every Australian. And now more than ever, we need to remain vigilant. We need to stay home if you're sick and get tested. Continue with that cough etiquette, hand hygiene, and wherever possible, continue with the 1.5 metres of physical distancing. These are the things that now we have proven a second time can bring down any community spread. And these are the things we need to continue to do so that we don't see a resurgence of community transmission as we move towards summer. So again, today it's really great. In New South Wales, we've seen now a 4th day of no community transmission, and that is an enormous effort by all New South Wales persons and also, of course, their public health unit. In Victoria, we continue to see really, really encouraging reduction in numbers with just 10 cases today. And again, I congratulate all Victorians on the sacrifice they've all had to make during this time. We know how difficult it has been for all of you, and we are, if I speak on behalf of everyone, how much we appreciate what all Victoria has done to bring these numbers back to this that we've seen today. And I particularly want to acknowledge the enormous effort of all of the healthcare workers across Victoria who had to contribute to the outbreak in this second wave. And remind ourselves that that includes those people who work in public health, those people that have worked tirelessly, day and night, 24/7, doing that test, track, trace and isolate that we know is critically important. They're often unseen and unrecognised, and they have been a major contributor to the slowing of the spread in Victoria and these dwindling numbers, and I particularly acknowledge their efforts during particularly the outbreaks in Victoria. We know that the high rates of testing has been particularly a part of our Australian response, and we are seeing dwindling numbers. So again, I'm asking you on behalf of the Australian government and on behalf of all of the people of Australia, if you have any symptoms at all, however mild, please stay home and get tested. We've heard recently today a research report from Monash University suggesting not only are people not getting tested when they have symptoms of cold or flu, but in fact that they're going out to work or out into the community. And these are the actions of people that will cause us to see a resurgence of community transmission if they don't adhere to what we're asking them to do. It may be that those cold and flu will simply be that, a cold. But please, if we want to get back somewhere near our normal life, we all have to make the effort. If you've got symptoms, get tested for all of our sakes. Finally, it's important for me to remind people that you need to look on social media to the most reliable places where you'll get the right information. In COVID-19, of course, we've seen a surge in the use of social media, but again, I remind you, if you go to somewhere like health.gov.au, you can be confident that the information we are providing to you is reliable and is based on the best evidence that we continue to examine have done so now for a number of months. And so you can have confidence in what we tell you is based, as I say, on good evidence. I'm happy to take questions now, and I think the first question is from Anne. Sorry, Anna.
Oh, hello. Alison from ABC. Thank you so much for your time. Can I just clarify something that the Prime Minister mentioned earlier today about the decision-making of the AHPPC in terms of the possibility of home quarantine? What options are being considered in terms of how that would work and when that could be in place?
Thanks, Anna. Yes, as you know, we have increased the number of people returning from overseas now in an aim to get as many back as we can. An AHPPC considered yesterday and will continue to consider what we know about the current evidence around those returning, what our testing rates are telling us about people returning, and what might be a range of options for people as we move into the new year. Is home quarantine an option? What are the alternatives? We do look to try and get back as many people as we possibly can, and so we're looking at a range of options. Obviously, it needs to be proportionate to the risk, and that work over the next few weeks will ultimately result in a recommendations made to the National Cabinet on whom any decisions about home quarantine or any other aspects of returning travellers will be made.
And if I may, just to follow up on that, in terms of how that people might be monitored, would there be any consideration, or has the AHPPC considered whether or not tracking bracelets might be useful?
I think there may, Anna, be a place for technology. I don't think that we've reached that position yet. I think we need to look at what are the associated risks. We know that how difficult it can be for people with disabilities to be in hotel quarantine, those with families. So it may be that there'll be a range of options. And then how do you ensure compliance with that home quarantine is part of that consideration. But I don't know that we've yet gone, Anna, to any particular technology, although I understand that Western Australia has just announced a new app that they're launching that may aid them in monitoring the compliance of home quarantine in Western Australia. So we will see over the coming weeks how that performs and whether or not that's an option that the state and territory might use to ensure compliance with any quarantine requirements. Have you another question, Anna?
Oh, thank you. Also, we heard today from the Health Secretary that in reality there could have been quicker decision-making in terms of what was happening in aged care in Victoria, and that some deaths may, in fact, or the spread of the illness which led to deaths may have been avoidable in hindsight. You, as Chief Nurse, knowing how important nursing staff have been in that process, what do you think about whether or not some deaths could have been avoided if different actions were taken?
Anna, as a member of the team that was in Victoria that set up the VARC, as we now know it, or the Victorian Aged Care Response Centre, certainly with the benefit of hindsight, it may have been that perhaps we could have set it up earlier. But certainly once it was set up, we were able to get that really tremendous collaboration between so many parts of the system that minimised further transmission and minimised the number of deaths. I don't know that we can quantify if and how many deaths might have been avoided if a different approach had been taken, but certainly the lessons learned from our experience in the response centre in Victoria are now those lessons that have been applied to every other state and territory, so that those states and territories are ready and able to respond to any outbreak, and based on certainly the experience we had in Victoria. So yeah, that's certainly, with retrospect, that we may have gone earlier, but unquantifiable as to how many deaths that might have avoided. Katina, you have a question for me?
Yes, just following up Anna's questions around home quarantine, could you speak around, I guess, what kind of policing capacity would be needed to back up that regime if you have people staying at their homes as opposed to a couple of centralised hotels?
Katina, I'm not an expert on policing, so I'm not sure that I can speak on the volume of policing that might be required. Certainly, on my return from Victoria, I too was required to home quarantine for 14 days, and I was really appreciative of the support that the Federal Police provided to me, checking on me every day to make sure that I was able to comply with the requirements and providing that point of contact and support. So I think going forward, if and when we do move to more home quarantine, the supports provided to people to ensure they can comply with those requirements will be an important part of the role of policing across Australia. And we know that so far we've seen our police officers support those responses in a very positive way. So I think that although the volume and the numbers of those will be for others to speak to.
Okay. And do you think that there would be, I guess, a triaging process, perhaps depending on where people are coming into Australia from? For example, if they're coming from New Zealand versus from America, as to what kind of quarantine will be most appropriate?
Yes, Katina, I do. I think that different countries will have different risk profiles. Obviously, the longer someone has been in an area, particularly, for instance, such as in Europe at the moment, where we're seeing, sadly, the numbers increase at an incredibly fast rate. A risk assessment based on not only where you're coming from, but also a risk assessment based on your needs. Where, again, you know, if you have small children, if you have disabilities, if you have special needs, how we might accommodate those needs going forward. Is it in a hotel? Are there any ways and means that we can increase that capacity so we can get more Australians home? All of these are part of that complex mix of decision making that's being considered by AHPPC, and as I say, will be made in due time as a recommendation to National Cabinet. Thank you for your time. Thank you.